I guess my first question is, can you take me through the impact that the COVID-19 pandemic has played on this opioid epidemic? What are the contributing factors?
We've seen an increase, unfortunately, in the number of people who've overdosed on opioids during COVID-19. We're not sure exactly what that number is yet because it hasn't been calculated, but I think the feeling is it's going to be higher than it was last year. And last year, there were about, I think over 70,000 overdose deaths total. Half of those were related to opioids. But I think it's important to realize that among those half, that is, among the half of those people who died from opioid overdose, they were mainly illicit opioids, like fentanyl, for example, not prescription opioids. And I think that's an important distinction.
Can you actually talk more about that, like the importance of this distinction between illicit and prescription opioids?
Well, the distinction is this, that for initially the opioid epidemic was due to the use of prescription opioids. So there were overdoses related to prescription opioids. And then it transitioned to heroin, overdoses related to heroin. And from there, what we've seen the last couple of years is mainly opioid deaths related to illicit drugs, illicitly manufactured fentanyl. These are synthetic opioids that people are getting from the street, not from healthcare practitioners. Also, now remember, fentanyl has about 100 times the potency of morphine, which is why it so quickly leads to death. Fentanyl is one, carfentanil is another. It's another synthetic opioid. Again, that has even a greater potency than fentanyl does. So that's the distinction.
You had mentioned previously in a statement that especially during this pandemic, there's correlation or association between access to, I guess, drug supply chains and the increase in death. Can you just elaborate further on sort of how this association works?
Well, what we're seeing, I think, due to COVID-19 is due to a lot of social isolation, depression, anxiety, economic loss too. People are turning to street drugs and specifically opioids. Not only opioids though, we're also seeing people turn to illicit drugs like heroin, cocaine, methamphetamine are on the rise. And I think we're seeing this because of the devastation related to COVID-19 on an emotional level. And I think it's a coping mechanism. I mean, people use mind and mood altering substances like opioids and others to change their mood and make them feel better. I think that once we get a vaccine, which hopefully will come soon, we'll see fewer opioid overdoses, fewer overdoses related to illicit drugs.